Fertility problems are fairly common. 10 to 15% of couples present for seeking fertility treatment. Human beings are generally not a very fertile species. The average chance of conceiving during a normal menstrual cycle is about only 6%. Despite this, 20 to 30% of couples would normally conceive within the first 2 to 3 months of trying, and over 80% would conceive during the first year and about 90% by the second year. This is generally relevant for low-risk couples, that is couples who do not have any specific obvious risk factors and are less than 40 years of age. However, there are a few basic tips that the British Fertility Society, the BFS, suggests that any couple who are trying to conceive may keep in mind. The most important parameter among these is probably weight, and not specifically weight but rather BMI, that's the body mass index, and this is calculated by dividing the weight in kilograms by the height in meter square. Now, we don't have to calculate using this very complicated formula. There are many tools, many calculators available online, and we can just have to input our weight in kilograms or even weight in any other units. It will normally change into kilograms and our height, and it will calculate. And a body mass index of between 19 to 25 is considered ideal. A body mass index less than this is detrimental, will delay conception, and therefore one may need to gain weight. But a higher body mass index is generally worse and definitely delays fertility, particularly in the context of polycystic ovarian syndrome. And therefore, one needs to reduce weight by the usual methods of exercise and diet control. A good plant-based, more fiber-based diet definitely helps. Apart from weight, smoking is definitely detrimental for both the male and the female partners. Ideally, one should completely stop smoking while they are trying to get pregnant, and smoking cessation services are available in the NHS, and your GP might be able to help you with that. Alcohol ideally should be stopped again while one is trying to get pregnant, and definitely during pregnancy, and no more than 1 to 2 units per week for the woman and 2 to 4 units for the man while they are trying to conceive is recommended. Caffeine in high doses can also be harmful, and only 1 to 2 cups of coffee per day for the woman is what's suggested. While one is trying to get pregnant or trying to conceive, folic acid needs to be taken. The usual dose is 400 micrograms or 0.4 milligram a day, and that is the dose that is available in most over-the-counter pregnancy, pre-pregnancy pills that are available, or tablets or capsules that are available. It has been proved that folic acid does prevent neural tube defect, that is spinal cord problems in the baby. However, in some cases, particularly like in women who are taking certain anti-epileptic medications, one may need a much higher dose of 5 milligram, and it has to be prescribed by a GP, so your GP is the best person to see to prescribe it. Any chronic medical conditions like diabetes, thyroid, blood pressure, kidney disease, epilepsy, one needs to see a GP before even planning a pregnancy, ideally, so that one can optimize the disease condition so that it does not create a problem during pregnancy or after that, or also the pregnancy itself does not hamper or alter the course of the disease either. Also, various medications that one takes for, say, hypertension and other conditions may need to be changed when one is planning a pregnancy to prevent any complications. Apart from this, the next important thing is, of course, the timing for the intercourse. Suffice it to say that regular unprotected intercourse does help conception, and by regular unprotected intercourse we generally suggest twice or thrice a week on a regular basis. Long abstinence does not help sperm count or the quality. In fact, it is harmful for both the count and the motility, and therefore not recommended at all. A fertile period is often used, and the principle is to find out the time of the ovulation during a menstrual cycle, and for that one often uses various kits available in the market, which could range from a temperature chart which is basal body temperature, to cervical mucus, to urine hormones in the urine. They do give you an idea about ovulation, and therefore the fertile period usually is a range of 6 days, which includes 5 days before ovulation and the day of the ovulation. However, this can be time-consuming, costly, and of course can induce a lot of anxiety and stress. Most importantly, orgasm, specific positions, and bed rest after intercourse do not help fertility and are not recommended. In summary, therefore, a good healthy lifestyle with good diet, light exercise, not too much exercise of course, and maintaining a normal body weight, avoiding harmful elements like smoking, alcohol, caffeine, taking folic acid regularly, optimizing any chronic medical condition, and having regular unprotected intercourse is all that is required for most couples to conceive.